Aura presents EBOO, Cellular Activation. Your body has an extraordinary ability to heal itself, but sometimes that ability gets buried under years of inflammation, environmental toxins, and cellular stress. What if you could activate your body's own healing power, not by adding something artificial, but by awakening what's already within you? In our modern world, your bloodstream faces a constant battle. Environmental toxins, processed foods, chronic stress. They create what scientists call oxidative stress. Over time, this accumulates, and your cells, designed to protect and repair you, begin struggling under the load. Today, we're going to show you how EBOO therapy works with your body's natural systems to address this at the root. Welcome to Aura Regenerative Medicine. Here's what's actually happening inside your body. Your blood is roughly 55% plasma and 45% cells. That ratio matters. When inflammation and toxins accumulate in your bloodstream, they take up space that your cells need. Your red blood cells start getting crowded. They stack together. Doctors call this rouleau formation. And stacked cells can't carry oxygen effectively. Only the outer surfaces can bind oxygen. The cells in the middle are essentially suffocating. Now your tissues aren't getting the oxygen they need. Your mitochondria can't produce energy. Inflammation spreads. You feel it as fatigue, brain fog, pain, whatever your weak point is. This isn't a single disease. It's a root cause behind dozens of conditions. EBOO addresses this directly. EBOO stands for extracorporeal blood oxygenation and ozonation. In plain English, we're oxygenating and activating your blood outside your body, then returning it revitalized. During a single 60-minute session, we circulate 2.4 to 4.2 liters of your blood. That's roughly half to 3/4 of your total blood volume. You're completely comfortable and relaxed the entire time, and the procedure is painless. There's a small IV in each arm. One draws blood out, the other returns it. Here's what makes EBOO different from other blood therapies. We're not just cleaning the blood. The goal is activation, waking up your cells so they can receive and utilize oxygen properly again. Filtration creates the space. Oxygenation and ozonation do the work. Now here's what's really happening, and this is important. Yes, we remove impurities, inflammatory debris, toxins, everything crowding your bloodstream. That's gone. But that's not the main event. Think about it. When your blood is crowded with inflammatory debris, your cells are stacked together, suffocating. They can't do their job. EBOO clears that congestion. Then, and this is the key, oxygen and ozone activate your cells at a level that goes far beyond just cleaning the blood. We're not just tidying up what's in your bloodstream, we're triggering your cells to wake up and function again. Here's the science, and I promise to keep it simple. Think about lifting weights. You create tiny tears in muscle fibers. Sounds bad, right? But that controlled stress signals your body to rebuild them stronger. That's called hormesis. EBOO works the same way, at the cellular level. A precise, controlled pulse of ozone creates a wake-up call for your cells. Not enough to cause damage, just enough to trigger your body's most powerful repair mechanisms. When ozone contacts your blood plasma, something remarkable happens. It immediately creates two types of messenger molecules. First, reactive oxygen species, including hydrogen peroxide. Now, before you worry, this is the same natural compound your immune cells produce to destroy invaders. Your white blood cells make hydrogen peroxide during what's called a respiratory burst. These reactive oxygen species do three things simultaneously. They improve how your red blood cells deliver oxygen. They activate your immune system. and they signal platelets to release growth factors for cellular repair. Second, lipid ozonation products. We call them LOPs. These slower-acting messengers travel throughout your body for days after treatment. LOPs trigger your blood vessel lining to release nitric oxide, improving circulation. And they activate the NRF2 pathway, your body's master switch for protection. When NRF2 turns on, your DNA starts producing powerful antioxidant enzymes: glutathione, superoxide dismutase, catalase. These are exponentially more effective than any supplement you could take. Your body is literally upgrading its own defense system. Here's why EBOO creates lasting change, not just temporary relief. Other blood therapies clean what's circulating in your bloodstream. That's extracellular, and it helps, but the problem usually starts inside your cells. EBOO goes deeper. The signals we trigger don't stop at the blood vessel wall. They penetrate into your cells, the intracellular level, where oxidative stress actually originates. Your mitochondria reactivate. Your cells start producing their own protective enzymes again. The root of the dysfunction gets addressed, not just the symptoms circulating in your blood. That's why the benefits continue building for days and weeks after treatment. We're not just cleaning up, we're rebooting the system. At Aura, we use the Trigon Kaizen system, and we offer both EBOO and EBOO Safe protocols. EBOO Safe stands for Simple Access Fluid Extraction. It represents 25 years of continuous improvement, what the Japanese call Kaizen. EBOO Safe adds 4 key enhancements. First, advanced ultrafiltration. Specialized membranes remove uremic toxins, microclots, heavy metals, pathogens, and endotoxins before ozonation begins. Second, optimized ozone and oxygen dosage. Concentration and exposure time are precisely controlled to maximize benefits while minimizing oxidative stress. Third, fluid extraction. For patients with fluid imbalance, whether from heart conditions, kidney issues, or inflammation, EBOO Safe can remove excess fluid. Fourth, monitoring of blood flow, heart rate, and oxygen levels in your body. Your Aura physician will recommend EBOO Safe specifically for complex cases, severe infections like Lyme disease, autoimmune conditions, post-chelation protocols, or situations requiring more intensive filtration. For many patients, standard EBOO provides excellent results. The right protocol depends on your specific situation, and that's a decision we make together. So what can you actually expect from EBOO at Aura? In the short term, often within days, many patients notice their thinking gets clearer. Brain fog lifts, energy improves. Not the jittery kind, but sustained, clean energy. Sleep deepens. Pain and inflammation often begin to subside. It's worth noting, if you're carrying a heavy toxic burden, you might feel a bit tired or achy after your first session. That's actually a good sign. Your body is processing and clearing accumulated debris. Most patients feel significantly better within 24 to 48 hours. Long-term, we're talking about rebuilding health from the cellular level. Balanced immune function, improved circulation, enhanced metabolic health, reduced systemic inflammation. This isn't a quick fix. It's a foundation for lasting change. While a single EBOO session provides real benefits, at Aura, we recommend the complete protocol for lasting results. Here's how a typical week looks. Day 1, EBOO session. This activates your cells and gets the process started. After a 2-day rest, we do chelation therapy followed by EBOO Safe 3 to 4 hours later on the same day. The chelation mobilizes stored heavy metals from your tissues. Then EBU-Safe captures them while delivering full oxygenation and activation. 2 to 3 days later, we repeat. Chelation, wait 3 to 4 hours, then EBU-Safe again. The spacing matters. Your body needs time between sessions to process and respond. Each round builds on the last. For the most comprehensive results, many of our patients complete this week-long protocol twice. Think of it as preparing soil before planting. The more thoroughly you prepare, the deeper the results take root. And here's what matters most. Every other therapy at Aura works exponentially better after. Your cells are finally ready to receive. To prepare for your session at Aura, hydrate well before your session. At least 8 glasses of water in the 24 hours prior, enhanced with electrolytes or a pinch of Celtic sea salt. Please avoid coffee and alcohol for at least 24 hours around your EBU session, as they can dehydrate you, stress your liver, and interfere with optimal treatment benefits. Eat a balanced meal with protein and healthy fats 1 to 2 hours before. And importantly, pause high-dose vitamin C and E supplements for 24 hours. They can interfere with the therapeutic signaling we're trying to create. During your session, you'll be comfortable, relaxed. Most patients are surprised how easy it is. At Aura, we believe in working with your body's own healing intelligence. We're not adding something foreign. We're removing what's blocking cellular function and activating what's already there. Your cells know how to heal. Sometimes they just need the right conditions to do it. If you'd like to learn whether EBU might be appropriate for your situation, we invite you to schedule a consultation with the Aura team.